네, 두 번째로 발표할 회사를 소개해드리도록 하겠습니다. 두 번째로 발표할 회사는 저희 스파크랩 글로벌 펀드에서 첫 번째로 대만에 투자한 회사입니다. 이 회사는 요즘 각광받고 있는 분야인 헬스케어 분야의 스타트업인데요. 그 중에서도 관리가 굉장히 어렵다는 당뇨 질환을 혁신적으로 개선하고자 하는 서비스를 진행하고 있습니다. 지금은 대만에서 서비스 중이지만 앞으로 아시아 지역으로 빠른 시일 내에 확장할 계획이라고 합니다. 여러분 멀리 대만에서 온 헬스2싱크를 큰 박수로 맞이해 주세요.
Good afternoon. It's good to be here in Seoul. My name is Ed Dang, co-founder and CEO of Health2Sync. At Health2Sync, we are transforming diabetes care. Diabetes affects 420 million people worldwide. Half of them are in Asia. There is no cure to diabetes, and it can only be managed. But there are monetary consequences to managing diabetes. According to the Public School of Health at Harvard, it costs $825 billion a year to manage this. When not managed properly, diabetes can cause complications like amputations, blindness, cardiovascular diseases, and kidney failure. Now, this is personal to me because all my grandparents and parents are diabetic. In fact, we've lost 3 of them to the complications that I just mentioned. It is also this family history that gives me a greater than 50% chance of being diabetic myself. Now, the complications are preventable, but the key to managing diabetes is to constantly measure blood sugar and adjust lifestyle accordingly. In other words, patients need real-time care. Patients measure blood sugar multiple times a week, but the data is stored in a glucometer or in a paper logbook. That makes it impossible for the patients to receive real-time feedback and coaching on how they're doing. Now, even if the data is available, diabetics need certified diabetes personnel to monitor and coach their conditions. However, there is a huge global shortage of these certified personnel. For example, in Taiwan, where I come from, the ratio of certified personnel to patients is 1 to 900. Now, when you combine all the Asian countries together, that ratio now skyrockets to 1 to 21,000. A huge problem. So now you know about the limitations of modern-day diabetes care. I'd like to now introduce you to our solution. First, our mobile app can connect via Bluetooth to the different glucometers. The mobile app also allows users to manually input relevant data like food, exercise, insulin, and medication. Now, for the patients with legacy glucometers, our smart dongle is compatible with 80% of the glucometers in the market. The smart dongle allows the patients to easily download data to the mobile app. Lastly, the data is uploaded to our cloud-based patient management service. On this platform, the care providers can access, monitor, and give real-time feedback. This platform also enables the care providers to cover a wide and large base of patients. Let me now show you how the system works. In just 18 months, we are now the #1 O2O diabetes management solution in Taiwan, with 61,000 registered users and 70 hospitals and clinics on our network. That represents a market share of 20% of all hospitals and clinics that are dedicated to diabetes management. We've also helped high-risk patients reduce blood sugar by 16%. Now that translates to significant reductions in risk and complications that I mentioned. Ladies and gentlemen, the future of diabetes care. With our focus on analytics, we are automating and personalizing diabetes care. We will also incorporate machine learning-based technology to alleviate for the shortage of the global personnel I talked about. Now, historically, diabetics were rejected from private healthcare insurance. As one of our business models, we are now working with regional insurance providers to create diabetes protection so that diabetics, when using Health2Sync, can also receive long-term healthcare insurance. While we believe we've done well in Taiwan, as next steps, we have signed partnerships for Japan and Hong Kong and are in current discussions with regions like Southeast Asia and Hong Kong, and as of yesterday, Australia. We are honored to be the first company in Taiwan to receive funding from Alibaba, SparkLabs Global, and joined by cross-border venture capital firms like W.R. Harper and Cherubic Ventures. I am a two-time serial entrepreneur. I'm joined by my co-founder, Ken, who is a computer science major from Stanford. Together, our team shares experience from pharmaceuticals like MSD and other companies like Oracle, Yahoo, Lehman Brothers, and McKinsey. We are also very, very fortunate to be working with the leading professionals in diabetes care of Asia. In the end, as diabetes is a disease that does not discriminate and fought globally, from day one, our mission has been simple and clear, and that's to create a scalable solution so that every diabetic in the world is cared for. Thank you very much.